So all these different landmarks that we talked about on here primarily are going to have to do with places where muscles are going to attach. And then as we get down here, you're going to have the actual condyles, which is the articular surface. And then what do you usually have next to condyles?
Ridges?
Oh, like on here, on the forearm, we had condyles, and then what do you have? What's this and this? Yeah, epicondyles. So you have medial epicondyle, lateral epicondyle. Same thing. And then you're going to have, instead of supracondylar ridge like we had in the humerus, we're going to have a supracondylar line on here. Right? And then those two kind of come together, and then they form this linea aspera, which is on the back side of the femur. Right? So that's where a lot of the adductors are going to attach to. And then you're going to have this intracondylar notch. So that intracondylar means it's between the condyles, right? Makes sense. And then the surface that articulates with the patella is going to be here. Okay. So in this situation, it's different than the elbow. In the knee, you're going to have the patella, which is a bone that's inside of the tendon. Okay. It's going to give it a little bit more mechanical leverage to pull on. It's going to make the knee a stronger extensor than it is than the elbow is. So the neck is most of the time where you have fractures of the femur. Right? That's the weakest part. So when you hear people fracturing their femur, typically that's where it is. And then that's the part when they get a joint replacement, they get a titanium or whatever metal it is they're using that replaces the femur and then the neck, and then they cut this off here and then they drive the metal back down into that, and then they also have an acetabulum on the other side where they have an artificial hip replacement. Right? So again, this fovea capitis is this indentation or dip in the head of the femur where it has the ligament teres, which is what holds it to the acetabulum. So if you pull this femur out, there's a ligament that goes from the fovea capitis to the acetabulum. And that carries a blood vessel that goes through it. And that helps to supply blood to the head of the femur.
Do they add that during a hip replacement? Do they feed?
Well, it's not going to need it anymore because it's not live tissue anymore. The metal's not going to need blood supply.
So it only feeds to the head?
It's feeding up the top part here. There's other branches that come down off of the femoral artery that are going to go into the femur. Right? So that's more just because again, you have the epiphyseal plate. Remember we talked about bone growth. So it's not going to go across the epiphyseal plate. So this area is going to have separate blood supply. And then this is going to have another one coming in from the middle. To the question. Right over here.
When older people generally fall down and break their hip, what are they talking about? Is
Femoral
it part
neck.
of the femur or is it
Yeah,
the
femur. Yeah. Sometimes they break their hip and they fall.
You can break the pelvis too, right?
Yeah, but it's usually the femur. It's usually the
Neck.
femur. You understand what I mean? And sometimes they can have osteoporosis and they might twist or move something. Their hip breaks and that causes them to fall. Or they can fall and that causes their hip to break. But mostly it's because there's weakening osteoporosis in the hip. And they could, usually pelvic fractures are more traumatic, where high-speed impacts, things like that, where it's not just a fall, but it could happen. And so then patella, that word means a small pan, so that's a triangular-shaped bone. And again, it's really inside of the tendon, so it's almost like it's a contractile tissue where it's part of the tendon, because it gives that tendon a little bit more mechanical advantage to pull across the femur. All right, so you remember when we talked about the upper arm or the humerus, how many compartments were there? I mean, there was basically a group of muscles on the front, which was what? Primarily the biceps, right? And then on the back, we had primarily the triceps. Okay? In the thighs, a little bit different though. We're going to have an anterior compartment, posterior compartment, and then a medial compartment. Okay? So there you're going to have the adductors in here. And then what would be the main muscles in the anterior compartment? quadriceps. I got my handy dandy one there. And I was walking around with a sword and a pistol on somebody's arm and had different ideas of what was going on. So we can use this to talk about the different muscles. Okay, so we're going to have the quadriceps on the front. Does anybody know what this one is? Okay. What's the name of this bone here?
Femur.
Femur. And if there's something that's long and straight that went across here, what would be a good name for it? Okay. Rectus femoris. Okay. And then, but let's not get into the specifics yet. Basically, we're just talking about there's the quadriceps is the main muscle in the anterior compartment. The adductors is the main group of muscles on the medial compartment. And then what's the main group on the posterior compartment?
Hamstring.
Hamstrings. Okay. And then what they're all enclosed is called the fascia lata. Okay? So there's the fascia lata, which is a sheet of fascia that encloses the whole thigh. And then you have a thickening of that on the lateral side. Anybody know what that's called? Yeah, the tibial band. Okay. And then there's two muscles that are going to go into that. One that's more on the front here, which is what? It makes the fascia lata tight, so what would you call it? Tensor fascia lata. And then this one here, the glute. So those are both going to insert onto this thickening of fascia. So the glute comes from the backside, and the TFL comes from the front. Okay, so then if we're talking about the anterior compartment, what's the main action that those muscles would do? They could act at two different joints, right? If they act at this joint, what would they do? Flex. Okay? But there's only one of those that's going to cross the hip. All four of them are going to cross the knee. So if the muscles are here, what are they going to do at the knee?
Extend.
Extend the knee. Okay? And then what are the muscles on the posterior thigh going to do? What are they going to do at the hip?
Extend.
Extend. What are they going to do at the knee? Flex. Flex. Okay? And then the muscles on this compartment, what are they going to do? Adduction. So then you have the ball and socket joint of the hip. Okay, that's what kind of axial joint is that? Multi-axial. Then you have circumduction, flexion, extension, all those motions. Okay? And the main thing that's going to flex the hip, if you just have this little rectus femoris, okay, is that going to be a strong hip flexor, or is it going to be the psoas that comes from in the abdominal area? Be the psoas. Okay. So the psoas is going to be the primary hip flexor, but also you're going to have the TFL and the rectus femoris. Okay. And then the muscles in the medial compartment are also going to help with flexion too. And then, like we mentioned, the thigh extension is mostly going to be between the glutes and the hamstrings. Okay. So the glute's going to do extension more from when you're in this position here. So it's going to extend it back forcefully like this. All right, so what's this muscle here? Okay, it's coming from the lumbar spine, and it's going across, and it's flexing the hips. So psoas, and then you have this other part here coming off the ilium, the iliacus. Okay, so together, those are called the iliopsoas. So they're going to be hip flexors. And we'll show more of these muscles. It's just to kind of get an overview of the muscles here. And then, do you know what this one is coming across? That's sartorius. Sartorius, yeah. It's named right because sartorius means tailor. So if somebody's a tailor, they sit like this when they're sewing. And then you're going to have this anterior compartment here, which is going to be what? Remember? What are these muscles? Quadriceps. And then here it gets into the adductor muscles. All right.